I've lived in the Red County for many years, but I think I was allowed through the country barrier due to being basically a southerner, born and brought up in Kent. In 2009, I had a stroke, and it's not unusual for stroke survivors. I have problems with words, so I'm going to have to use my notes. Sorry about that. My story goes back to 1955, when as a teenager I caught paralytic poliomyelitis. After a couple of years, it left me with some lower back and leg weakness. Jump forward then to 2000, when I started experiencing some problems with my heart rhythm, sometimes just for a few minutes, other times for up to 12 hours. I saw my GP, who referred me to a consultant, a cardiologist, but the funny feeling never happened during any of those appointments, so I was just left to get on with it. O for a cardio in those days, a simple but so efficient piece of technology. When I had the stroke in March 2009, again right-sided paralysis is where the polio connection slips in. No one had any knowledge of polio or subsequent post-polio syndrome, which meant it was hard for anyone to set me targets because I had no details of the previous weakness and I wasn't in a position to either work with the physio or set targets for myself. I now recommend to all stroke patients, with any success, no matter how small, they report it somehow, either to a friend, a relative, on a tape, on a computer, anywhere, just so that you can see what happens. Two occasions in particular come to my mind. After a very long route to recovery, the very first time I was able to use a pair of secateurs in my right hand, and the very first time I was able to flip an egg in the frying pan. May sound simple, but so important. Unfortunately, I'm still unable to write legibly after my stroke, or take the eyes out of new potatoes, although I can prepare most foods for Colin to cook. Then during the third week in hospital, after my stroke, the pulse symptoms returned. I tried to explain that it was okay, and it would go in no more than 12 hours. Stupid female logic. It was diagnosed as PIT AF. Whoops, I've lost my screen. Just hang about, we'll get back to it. That's right, back online. It was diagnosed as AF and treatment started with warfarin. It was subsequently suggested that the stroke might have been AF induced, as I'd been doing all the right things, going to the gym, not particularly overweight, never smoked, and drank within recommended limits. The post-polio syndrome diagnosis meant that I had been advised by the PPS consultant in St Thomas's, London, not to take standard statins, which were recommended at the time along with warfarin. My superb doctor, Michelle Kidd, looking after me at Warrington General, was good enough to take Colin's word for it, and she found a suitable alternative. Oh dear. Yeah. Should have had a paper note, shouldn't I? I'm going to be eroding into your lunchtime if I'm not careful. Got there. It's okay. We take answer. I was discharged in a wheelchair and unable to construct a sentence. I was again then referred to a different cardiologist as I'd been hospitalised outside my area. He suggested cardioversion, which lasted less than 12 hours, So I was then referred to a specialist in heart rhythms. But unfortunately, the waiting lists everywhere were very long. As I had medical insurance, decided to become a private patient, to visit Prof Gupta at Liverpool Heart and Chest, who over the next few years did 4 catheter ablations each time when I lapsed out of sinus. Unfortunately, I again relapsed at the beginning of COVID, and after a telephone conversation, agreed with Prof Gupta not to proceed with any more surgery, and I now cope just on medication. In my first year of recovery, I was visited home by a student, Emma, now a doctor, with whom I'm still in contact, who was investigating how stroke survivors coped in the period after discharge. The second month at home was the worst of the whole time. I'd been naively thinking, once home in a comfortable bed, having good access to good food, and being able to use the loo whenever I wanted, I was going to be better. When that didn't happen, I was really pretty desperate. I spent hours crying in frustration. I went to a Stroke Association group weekly meeting, which subsequently was forced to operate on a voluntary basis. I became a volunteer to assist with the group, was subsequently appointed a stroke ambassador for the region. Unfortunately, the voluntary group then closed. Later, perhaps 2015, I received an email addressed to all stroke ambassadors in the Northwest, asking for anyone who's interested in AF and strokes to contact a telephone number in Daresbury. I rang, was invited to a meeting to discuss, and left this meeting as one of the first group of Debbie Parkinson's AF ambassadors, with a cardio machine, full training on how to use it. Now I felt like I was starting on my quest to help others to perhaps avoid a stroke. If you consider that the average figure is 5% of the adult population with undiagnosed AF, I've now tested over 2,500 people. So I reckon I've got quite a few belts and things under my belt. In my opinion, it's essential that this service is protected and extended. So useful. During this time, I was still experiencing occasional AF, and having access, obviously, to my cardio machine, I was able to forward a trace to my heart rhythm specialist from my holiday hotel in Tenerife and get an appointment for the Friday after he returned home, which led to one of the 4 catheter ablations. A true example of the power of technology to use to everyone's advantage. The highlight of this voluntary role was the success of the project in the HSI Awards in 2021, the collaboration category, when I was honoured to be invited to the formal evening in London. When we arrived, we were seated at a table many, many yards away from David and Debbie. Debbie sent me a text message saying that if by any chance we were successful, that I should go on stage with them to receive the award from Sue Perkins. I admit I didn't take much notice, apart from thinking how to get my wheelchair from over there to the stage over there and then up there. Especially as I had an accident just a couple of months earlier with my caravan and fractured my left femur. So the right leg's dodgy, the right leg left us, and so I'm still on sticks. Anyway, we were very fortunate. The announcement was made. We had won. Dave and Debbie rushed from their table, took me by one arm each side and dragged me up onto the stage. Point to make here is the number of adults in the general public who have no idea how to check their own pulses, something we tend to talk to folk about after an AF test, if there isn't a queue waiting. We take the time until someone can locate their own pulse and know how to count it and report to GPs if bothered. I wonder if it could be worthwhile printing information, including statistics, put them in doctors' waiting rooms. Get people to just sit there and test their own pulse. After our success, it was discussed how we could develop the role, and it was decided that anyone who wished could convert and train in a new role as heart hero, also able to check blood pressures. I was already trained by the Stroke Association, so obviously changed my title and picked up a new t-shirt. Additionally, I've been involved in a research project run by HINWC on the subject of new technology BP machines. This is in its early stages, but hopefully will ultimately assist patients, GPs, cardiologists as another tool for people to use at home. Now, again, I need to backtrack. Around 2015, I was attending a neurophysio private gym, having been unable to access any NHS neurophysio assistance. At this time, I asked a few questions. I have to admit, I can't remember the topic, but it resulted in me being interviewed by a senior lecturer from Manchester Metropolitan University, asking if I was prepared to chat with final year physio students. I agreed, and that led to annual requests that COVID intervened. The students apparently reported that these chats as being the best informal part of the course. One day, around 2017, missed it again, a short notice appeared on the gym members' information board, asking if anyone had an interest in oral hygiene and strokes. Stupid me. Again, ring a telephone number. I rang the telephone number. Some 40 years earlier, I'd been a qualified dental chairside assistant. I was asked to attend a short interview with then Dr. Craig Smith. I was delighted to be able to be asked to join a project. Ooh, come on. Thank you. I was delighted to be asked to join the project into research of ability to access dental care after strokes. At the first meeting, had I been fully mobile, I'd have run away. Faced with all these highly qualified academic folk, but they were very friendly and convinced me that with my background would be very helpful. So I stayed, and it proved to be one of the best things to have happened to me since 2009. At last, I was able to give all my available time and energy to fulfilling not only myself, but also the stroke survivors community. I'm very pleased to say that the results of the first work were published with me as contributor. The involvement in general took me to a point where I was able to see that I wasn't totally a waste of space, and Colin and I will be ever grateful to Craig. Since then, I've been honoured to work with Craig, who insists he's addressed by his first name rather than Prof. Smith, on a trial, the results of which have also been published, and 2 further projects to which I've been asked to lead both of the different PPI teams. These cover post-stroke subjects in hospital stroke units across the whole of the UK, and are to last for 5 years. That takes me to 90, and I hope I make it to the end of both of them. In 2023, I was privileged to be asked by Craig to attend Forum, Nationwide Stroke Association Conference in Birmingham, and to address the meeting about my involvement in PPI. The AF and BP testing, plus the PPI work, have consumed me, and I've regained some of my previous self-confidence, which you lose when you have a stroke. I can no longer do housework, drive, cook, garden, IT, haven't control of mega budgets or the responsibility of ensuring that staff learn and enjoy their jobs. But at last, I feel I'm in a very small way contributing to improve lives of some patients and hoping to prevent others from suffering from strokes. Wait about. Something I'd like to suggest to all of you, regardless of your status or areas of responsibility, is at the end of the day, patients are usually quite good judges of their own levels of ability and commitment, and can often contribute a lot to success or failure. Some of them will hopefully get a boost to their self-esteem if you can consult them in a PPI role. You never know. You might be recognised by a patient as the one person who came to their rescue from a life of gloom and doom into something much more positive. Researchers and innovators, please consider using the lived experience of patients right at the beginning of your research. Make sure that it's something that a patient can really relate to and the possible benefit accruing. I think that's about the lot of my abridged story version. If there's anybody questions or comments, I'm ready to try and answer them. Thank you for all your attention.
Wendy, thank you so much for that. Thank you.
Sorry about messing them.
We do have time for maybe 1 or 2 questions. If anybody's got any questions for Wendy? Just one at the back over there. Thank you.
One there as well.
We'll take the one closest to us for now, and then we'll go and take the gentleman at the back, and then we'll wrap up.
Okay. Thanks, Wendy, for the talk. I really found that inspiring. Just a question really about what did you find really helped you with your stroke recovery, and was there any? You talked about some research that you took part in, but was there any other research that, like from universities and stuff, that really helped you?
No, I think it was just Emma when she came out to do the post discharge information, because every stroke is different. Every person's reaction is totally different. One thing that really bugs me is when TIAs are called strokes, because we have a couple of friends in our walking group. We're now lunching rather than walking group. But there are a couple of people there who've had TIAs, and they were always saying, well, I'm recovered. Why aren't you? You're not doing any work, which is so frustrating from a true stroke point of view. I've got friends who, despite all their efforts, haven't been able to recover their speech. I haven't totally recovered mine, but I've got enough to get by on. I think it's only... Thank you very much.
Okay,
Thanks,
you.
Helen. Let's just quickly get the mic across the room if we can. Helen's a gentleman just all the way over there.
Can I just add in the meantime that we've been doing quite a lot of work with mosques, and the populations are so grateful for anything we do. I don't think anybody leaves us without saying thank you for coming, thank you for working for us. And one of the very best results, or the best, not results, the best tests I ever did was when we were doing a session at a mosque where there was a foodie thing going on in the community hall. And 2 young gentlemen, probably early 20s, having had their food, came to have a look at us. Came in, I took one, Debbie took the other one. Debbie's was okay, but mine came up with the cardia as possible AF. So I just said to the gentleman, I'll just write you a letter, you can take it home to your doctor. No doctor. Sorry? No doctor. I didn't quite get the message, but he really didn't have a doctor. By that time, Debbie had finished her chat, so I said to Debbie, what do we do now? And she went outside, found a local lady who said, I'll sort it. She contacted a local GP, took the chap along and got him an appointment that afternoon. We've no idea what happened to him, but it was, very well worth done.
Thank you, Wendy. Final question.
Yeah, fantastic. I think for me, it's very inspirational to hear your story. And I feel like we can connect after this conference today, so you can appear on the podcast which I host, which is called Everyday People Talking Health, all the way in Manchester, but we'll find a way of using technology of connecting. I say it's very commendable to you because I live with a health condition myself known as ME/CFS, and I've come all the way from Manchester to kind of experience what healthcare and the sector is doing in terms of innovation and how we can champion patients' voices, because at the end of the day, people like yourself are great ambassadors into what solutions we can come up with and help future engagement with communities. So, well done.
Thank you for the comment.